Production funding for After Abbey on WPSU comes from Caparella Furniture, serving the area with furniture, flooring, and home decorating ideas for more than 60 years, with locations in Bellefonte and Lewistown. Information at caparella.com. And from Confers Jewelers on the Diamond in Victorian Bellefonte, a family and staff dedicated to bringing a taste of luxury and beauty to yours. And from viewers like you. Thank you.
Good evening and welcome to After Abbey, the live post-Downton Abbey interactive talk show where we invite you to discuss all things Downton with us. Good evening, I'm Whitney Sheridan along with my fellow producers and co-hosts Jessica Peters and Lindsay Whistle. To help us discuss tonight's dramatic episode, we have Professor Philip Wilson, a historian of medicine and science at Penn State's College of Medicine in Hershey, joining us by phone. He's a professor of medical humanities and in 1996 edited a 5-volume series entitled Childbirth, Changing Ideas and Practices in Britain and America 1600 to the Present. He's also a big fan of Downton Abbey. Philip, thanks so much for being with us. We have a lot of questions and a lot to talk about after this shocking turn of events tonight, and we know you do too. You can be a part of this conversation. Call us at 1-800-543-8242. Email us at afterabbey@wpsu.org or tweet a question to @AfterAbbey or visit us on Facebook at facebook.com/AfterAbbeyTV. We always welcome your correspondence. Philip, thank you so much for being with us tonight.
Well, Whitney, Jessica, and Lindsay, it's a great pleasure to be able to join you on this evening's After Abbey presentation. Wow, what a tragic and intense and emotion-filled episode this was.
It was certainly. And so tell us, it was a shocking turn of events, as I just said, but, tell us a little bit more about the preeclampsia, the clampsia that took Sybil in tonight's episode. I mean, this is something, that has a lot of history in medicine. Tell us a little bit about it.
Well, yeah, it sure does, Whitney, and it's one of those disorders that has really been around throughout recorded history, and it remains one of those. It certainly did in the 1920s. It remained an enigma at that time, and it does with us today in many ways. They really portrayed kind of the grouping of signs around this particular disorder, a very rapid increase in blood pressure and kind of an onset of edema, swelling, particularly around the ankles, and the protein in the urine, all very typical signs that were noticed then and even a few decades before the time frame that the episode was set in. So there was this cluster of signs surrounding this particular disease. Curiously, and I think one of the reasons that it's long been so hard to distinguish kind of preeclampsia, or as they talked about it in the show just briefly, something that has been referred to as a toxemia of pregnancy. One of the reasons it's been so difficult to both accurately and particularly diagnose is because a lot of the symptoms surrounding this, maybe the early labor pains like we saw Lady Sybil having undergone this evening, the backache, the headache, are all kind of reasonable, normal effects of pregnancy.
And that's something that we heard, Sir Philip.
Yeah, and Dr. Clarkson arguing about, and that has us wondering how much of this issue, you said it was a pretty well recognizable, even at that time, what was wrong with her. How much of this was a class issue? Because you had the know-it-all pompous Sir Philip, and then you had Dr. Clarkson, who maybe, he's made a few misdiagnoses since the show started, but he really called this.
Well, I think this whole season has really been drawing out kind of the post-World War I class social issues very, very dramatically for us. And boy, I see class at the center and all through this particular episode. It is a little surprising that Sir Philip, somebody who seems to be kind of one of these Harley Street London consultants in his specialty of obstetrics, perhaps even an older character than Dr. Clarkson, would have not recognized these signs, but more than anything else, it seems to me that his professional pride really took over what we might think of as professional judgment in this case. And it was really the tension between kind of the older tradition or the old guard that he represented, and in some ways kind of the newer or progressive, kind of more scientific-minded Dr. Clarkson in this case as well. I do think certainly that, and the class distinctions between them that came out, particularly when we had the doctor kind of private consultation out there, and Dr. Clarkson was at least attempted to be put in his place by Sir Philip. Yeah.
What was the Harley Street? Is that significant? Is in Sir Philip Tapsell being a Harley Street doctor?
That's a literal street in London.
But is there something significant?
I guess I'm assuming that's probably the area.
Yeah.
One of the big cities from where Sir Philip may have been drawn from. But
is there any? There's nothing significant about him being from that specific street or anything.
Well, it is in that it's really the upper crust of British society that could have afforded and often would only have looked upon physicians who had, if not a practice, at least a part-time residence on Harley Street. So that in itself is somewhat of a class distinction, class basis, saying you're going to a Harley or having being consulted by a Harley Street doc at that time.
Well, not surprisingly, this is Jessica. We have had a lot of action tonight on Twitter already, and just briefly, we do have a question for you from Twitter. But first, we've had a lot of reaction, both obviously about Sybil, but we've also had some reaction about the way that Lord Grantham acted in this situation. That he was pretty arrogant, the words that are being used here by our Twitter followers, and the behavior of him, and between Mary and Mary's attitude towards Matthew, always taking her father's side. But that aside, we did have one Twitter follower said that, so glad for modern medicine. Had it not been for it, my daughter would have been Sybil. And that's what I think brings us all so close to home. And I guess, being a mom myself, it's that fear that's always in the back of your head, and that something will happen to your child, and here now this child is going to grow up without a mother. So we also have a question for you, though, Philip. We have, how would the C-section have saved Sybil? What was it about that procedure? If she was already in distress, how would that C-section have saved her?
Well, and I will get to that, but I'd just comment very briefly upon what you had noticed, and perhaps other people had commented on, about Lord Grantham's particular situation. And to me, this is still, though we're in the time of change, and of course people living in the 1920s don't see all the change quite the way that we in history do when we look back upon it, but we're right in the midst of some change, and women are beginning to be respected and received in different ways than they had been before. Certainly the right to vote and all of that, but in some ways this is still very much a time period, as portrayed in this evening's episode, when men are still very much in control of women's bodies. And it's the Lord of the Manor that is still somewhat in control, though I would argue his control might be crumbling just a little bit, given the financial situations of that, and also kind of when he's looking around to try to decide who it is he should listen to. But even the women that are involved are deferring a decision to other men, including other non-medical men. As to the C-section itself, really, then and now, and even before that time, C-sections have in fact long been performed. The only so-called cure, or the best effective treatment, I should say, for eclampsia, that is kind of the full on-blown convulsions around the time of pregnancy, which can occur before delivery or after, as we saw tonight, is the delivery of the child itself. So the C-section may well have kind of removed what we think are some of the instigating factors, and that has to do in some ways with the creation of this very new entity in a pregnant woman, the placenta, and how it has been speculated to have been involved with that whole process. So by removing the child and presumably the placenta with it, you've taken away kind of the instigating factor of what might be, or was most likely thought to be, precipitating kind of the onset of these convulsions. One thing then, and now that you'd have to worry about, though, is the kind of state of development of the infant itself. If this is something that happens very early during pregnancy, and you get a very early premature baby in those times, that baby was not likely to survive. And of course, at earlier stages today, a baby is also much less likely to survive.
Well, Philip, I want to ask you about Sir Philip's points about public infection and hospitals, that he was talking about in the episode. But I also want to remind our viewers that they can definitely give us a call and ask you questions themselves at 1-800-543-8242. You are joining us by phone, and we appreciate your time. But we also want to hear from our viewers so they can get in on this conversation, because I know they've got lots of questions since we lost our beloved Sybil tonight on Downton Abbey, and we know that many viewers have questions as well, so we want to hear from them. But right now, I do want to get your thoughts, Philip, on those points that Sir Philip Tapsell was making about not doing the C-section, that there was, the possibility of infection at a hospital, and that was a reason for not doing it.
Well, certainly, I think hospitals and those kind of county hospitals or local community hospitals in some of the areas surrounding larger cities, anyway, were often still in the 1920s looked upon as kind of areas of second-level or second-rate medical care, or at least, if it was a non-emergent situation, a place where the aristocracy certainly weren't going to find themselves. Perhaps if they had an accident outside or close to a hospital, somewhat of a tragic accident, they might be taken there again for some kind of an emergent care. But another situation where I think they were used and that we saw portrayed this evening is really the emergency need that surrounds this and other kinds of very problematic and traumatic ends of pregnancy. So I think Dr. Clarkson was right in saying that if we move Sybil now, we have better surrounds there. We're in much more sterile surrounds in most county hospitals at that time, and you had your equipment there to perform a C-section is going to be much easier, and even the outcome may well be much better there than in the the highest level noble bed, an area that is still not very sterile and equipped like hospitals were at that time.
And I think, Jessica, that's actually something, you're actually answering some of the questions that some of our Twitter followers are having about this. People are wondering, well, taking her to a county hospital and doing a C-section, it might be more dangerous there, and I think that you've helped to address that. And we have a very good question coming to us from Facebook, who wanted to know, that yes, Sir Philip totally missed the diagnosis, but shouldn't the delivery have resolved this issue? That's part one of the question. And part two is, why didn't they use magnesium sulfate or phenobarbital, or why weren't there any drugs on hand to help offset this? Would there have been any reason for that, or was that just, you know, maybe creating some of the drama of television?
Well, the last part of that one, first, I think we've got a very knowledgeable contributor there of that question. Magnesium sulfate is still one of the kind of remedies that we would use to bring down, block, reduce, or completely eliminate those convulsions or the seizures surrounding that. Magnesium sulfate was known in the 1920s and slightly before to also be able to do that, and they were. It was known to have been given in what we think of as kind of intramuscular injections, just kind of shooting a syringe full in a muscle bed and allowing that to kind of disperse through the system. But it was not regularly performed at that time. Just because we had some people doing it doesn't mean that it was a standard practice at that time. Curiously, the things that they were doing much more readily at that time, and though they sound somewhat barbaric to us, and we may be surprised to find that they're still doing it, part of it has to do with what they thought the disease was being caused by. Again, it was mentioned in the show and referred to as the toxemia of pregnancy, which gives some clue that they thought perhaps there are toxins floating somewhere in the body, and one way to get rid of the toxins is to purge the body, to give somebody something that's going to bring up any of those toxins. Calomel or mercuric chloride was quite readily used for that, but also the swelling, the edema, kind of the rapid onset of edema. That was noticed. They were still bloodletting at that time as well, and giving some other medications to kind of increase the flow of liquid. But
we do have several calls that I do want to get to. So it sounds great that we're getting a lot of questions on Facebook as well, but I can't believe that they're still bloodletting at this time. That sounds...
you think that was
in that recent in our history that they're still doing that?
Well, and they are now some of what we might think of as the more heroic practitioners. That doesn't necessarily mean what we think of when we think of as hero.
Right.
But those who, in a state of an emergency or state of need, are trying just about anything.
Right.
But we can read a lot of case accounts from Britain, from the United States, where in these kind of extreme conditions, they were still kind of haphazardly, I would say, letting blood at this time.
Well, let's take a call now from John from Altoona and see what he has to say. Hi, John. How are you?
Hi, fine. How are you?
Good. And what do you think of tonight's show?
I was devastated because she was my favorite, Sybil was. So,
I think everyone lost a beloved character tonight.
Yeah.
Did you have a question for
I do.
For Philip Wilson?
For the doctor, yes, please. I couldn't help but think about you being a historian of medicine, and I wondered what the balance of women would be as you come into modern times here to the present, as far as, dealing with these kind of things and what that impact was, given, how many women are doctors today, and thinking about that in general.
Well, John, that's an incredibly important question, and you really hit upon a huge turnaround since the 1920s to where we are today, roughly that 100-year gap, where both in Britain and America we see more women training to be physicians, and certainly more training to be midwives and others that might care for this. So, but yet, though the kind of the image of the caregiver may certainly have changed, I still think the disease itself, a disorder that has often been referred to as a disease of theories, because there have been so many different kind of theories spouted off as to what was the cause underlying this, and to think that most of the treatments that were being reached for were going to be somewhat against that cause. It still remains very unknown, or certainly unproven, the direct causes for this and why it's going to set in. Someone else had asked a while ago about, well, wouldn't the pregnancy itself have eliminated the cause of the disorder, and certainly if the placenta was delivered along with that? It, seemingly so, but a lot of these cases of eclampsia set on after delivery as well. Seem like in the case of Lady Sybil.
And it seemed like she was all better
after that.
I know, and I think that's what we were all traumatized by. I know my mom's a nurse, and as soon as I watched this, I was, just absolutely traumatized, asking her all these questions about it. And it happened so fast, and I think we've established maybe there were measures they could have taken, but I was kind of shocked that both doctors just sort of stood by. And then in a matter of minutes, you just see, not even minutes, you see Mary drop her hand and just move away, and that's it. I mean, she's blue, and it was so fast.
And when Sir Philip put his hand over his face and he walked away, and because he knew there was nothing that could be done at that point, it was heartbreaking.
It did seem so fast to me. Would it really be that quick in real life, Philip? Would it really be that quick?
Well, again, I think we have to lean somewhat on the drama that they're trying to bring out within an hour show.
Sure.
But yes, it could certainly. I mean, the onset is that it can be that quick, and they did feed in some clues that, in fact, the opening scene. It was Dr. Clarkson taking a blood pressure there. Things seemed normal, and we saw that very kind of rapid rise in blood pressure toward the end.
I think only someone like you might notice that.
Although I do remember her talking to Mary, and again, it's so easy to confuse the typical signs of pregnancy, because she's saying, oh, I don't recommend this, my head hurts, my back hurts, my ankles are swollen. And you kind of ignore that at first because you think, oh, well, she's pregnant. It's
right.
It's not a day at the beach. But
Well, let's take a question from Cynthia from Muncie. Hi, Cynthia.
Hello.
And what did you think of tonight's episode?
Pretty shocking and pretty rough on the poor girl.
I know.
But I must say they did an excellent job of showing her appearing to be toxic, because I'm an old OB nurse. I've seen toxic women, and they look that bad and even worse.
Oh, wow.
But I have a question for Dr. Wilson. Would they not have had mag sulfate and or phenobarbital to treat her? This is 1922, not 1822.
No, yes, you're quite right. They were certainly out there and available. Excuse me, at least magnesium sulfate a little more readily. The phenobarbital that you mentioned, again, also used to bring down or ameliorate anyway the onset of the convulsions or the seizures, but it just had not quite reached I'd say a general practice. It was still widely I think as many of the treatments were trying to go against the perceived cause of the disorder rather than to treat the symptoms itself. Now we should also say here, I mean, we've been focusing on this eclampsia, this very and as we saw tonight, very potentially fatal end result of this. Not all cases then, in fact, the minority of cases then moved from preeclampsia into that kind of full burst effect of eclampsia. I think that's what the old Greek meaning is. It's kind of just a full bursting forth. This name that's just stuck with this this particular disorder. So, but I certainly appreciate Cynthia's thinking that some of these treatments, were available. They hadn't been widely disseminated within teaching at that time. So I hear you. We're not still in the 19th century, but again, just because some things show up, and we see this today, of course, too, because things show up in the medical reports and the medical literature, it still sometimes takes a while to catch on. Less so today, I think, because of our rapid forms of communication.
Right.
But,
well, we've got a couple more calls that we want to get to, and I know, Jessica, I think, do you have a question on Twitter or Facebook?
We do. We have an email question that we can get to if we want to get to it after the call.
Yeah, let's take a call from Anthony from Huntington. Hi, Anthony.
Hi.
Hi, how are you?
I'm okay.
And what did you think of tonight's episode? Do you have a question for...
It was unexpected, and it's always gets over too soon.
I know, I know.
My question was about the infant, actually.
Yeah. Great.
Was it common to have someone else breastfeed the infant, and also on the formula that they'll be given to him later? Is that something that is actually helpful in this situation?
Well, Anthony, the whole concept of wet nurses, that is, allowing another woman who had in fact given birth not so long ago, whose milk supply was still readily available, has been a commonly used practice, particularly, I'd say, in the aristocracy for centuries. And yes, they were still using wet nursing at this time. But curiously, and this is again, I think, the brilliance of the writers for this and the historical staff, I should say. This was exactly at the turning point when they were bringing in what they often called at that time dry nursing, and it's before the time that we have commercial kind of products like Similac and other formulas available, but the kind of precise remedies that they spoke about going into this percentage method were exactly the things that were being tried at this time, assuming or presuming, I guess, that they could actually create something that was just as good as mother's milk for these individuals. So now we're kind of in a new growing nutrition era where we think we can actually biomanufacture products, and here it's something simple you can do downstairs with sugar and honey and milk and cream, and put something together that is going to give sustenance. And it did take on for quite a while, but within the next decade or 2 decades, we do see a increasing number of kind of dry formula commercial products coming on the market.
I think we have time for one more call. We've got Judith from Johnstown on the line. Hi, Judith.
Hello.
How are you?
Oh, fine, thank you. How's everyone there?
Good. Little sad
holding
tonight.
it together.
Holding it together.
I saw it coming. I really did.
Yeah. It was quite a shock.
Looking back, there is some foreshadowing to it, isn't there?
Yeah.
Did you have a question for Dr. Wilson?
More comments than questions. I thought it was kind of unrealistic that they couldn't do anything. They were the they were the gentility. My late grandmother was a nurse midwife, and she would go to home deliveries, and there were situations very similar to this, and she would tell us. And what they would do is, in the 7th month or so of pregnancy, when this first manifests, is they would assure that the child would be delivered cesarean to prevent further damage to the mother and the child, or loss of life with both.
Right.
And I kind of thought it was unrealistic that they bickered back and forth, and it just bothered me that they kind of all stood there with their hands in their pockets and didn't even try to do anything, because, as the other woman said, there was magnesium sulfate, and what good doctor would not go to a birth without bringing magnesium sulfate? I mean, really?
Yeah. Judith, I hear those concerns very loudly. And one thing, importantly, that you brought up, and you see that in your own family, is kind of the growth of midwifery care. Again, we've had midwives for centuries, and really through all recorded history. But to use a midwife in an upper class family would not have been an acceptable practice at this time. And even to the best of my recollection, in the current series, that the television series of the midwife that takes place now several decades later in the 1950s,
On PBS.
On PBS, right here on WPSU.
That's right.
These are often, not always the case, but often women going out to serve the working class. And but it is back at this 1920 era that we don't yet have the kind of full support of what you're talking about, Judith, that your, I believe, grandmother was participating in, and that is kind of the whole prenatal care movement. And it's out of being unable to resolve some of these issues like preeclampsia and eclampsia of pregnancy and the high number of maternal deaths that we see at this time, that we do get a huge boost of kind of prenatal care movements at this time. Maybe this is going to be one of those areas where Lady Edith, as she starts to reach out and write about the progress of women at this time, and oh boy, is she going to have a wonderful, sad but wonderful case history to share with reading public.
Well, you know, one of the things, you know, we've talked about, so we could keep going on and on about this because Sybil was such a beloved character. I mean, even if she wasn't your absolute favorite character on Downton Abbey, I don't think anyone could find any fault with her. She was always kind and generous. She was independent. I mean, I keep thinking back to the example in season 1 where she helped Gwen, the housemaid, become a secretary. You know, she became a nurse in the war. So how is this going to impact the household?
And I think even, I mean, there's like the intensity of that is shown in the delivery room itself, but then whenever they go downstairs, and they're all just silent, stunned, and Thomas.
Yeah, and I was telling Jessica, that's what kills me is Thomas, who, you know, you don't really think of Thomas as being very sentimental, and even Thomas is just devastated by this news. 'Cause,
so that's just something to think about. So Philip, we have about a minute left, so real quick, how do you think the loss of Sybil is going to impact the rest of the house?
Well, I may not be as good as Judith, one of our callers, was about prognosticating some of these things that are coming along. But I think the whole evening show was also revolving around some issues of children and uncertain futures. We saw that with Ethel Parks, who had given up her child, now living with Mrs. Crawley. We see that with Matthew and Lady Mary, and kind of the uncertain future there too. Now we have a child, of course, whose father is still very much a big part of the picture, but is he a big part of the overall Grantham household? That I think is still to be unfolded in future.
There are a lot of questions that are unanswered, including calls that we unfortunately did not get to tonight. There are some emails and tweets.
They can email us, though, and maybe we can get them an answer.
That's right. So we want to thank our special guest, Professor Philip Wilson, a historian of medicine and science at Penn State's College of Medicine in Hershey, for being with us tonight on the phone. We hope you'll watch next week after episode 4 of Downton Abbey, when Masterpiece executive producer Rebecca Eaton will be speaking with us, and you can start sending your questions right now. Visit our website, wpsu.org/AfterAbbey, and facebook.com/AfterAbbeyTV. Also email us, afterabbey@wpsu.org. Thanks so much for joining us on WPSU. I'm Whitney Sheridan with Jessica Peters and Lindsay Whistle. Thanks so much. Good night.